Hi guys, I am Dr. Sushil Vijay, your Faculty of Orthopedics at DBMCI, and we are here today to discuss the INI-CET, the recalls. Okay, so questions were few, but yes, so many ups and downs in the exam, so many repetitions, mistakes, so many things. But with so many ups and downs, we learned that the topics which are frequently asked in the exam, they still remain same, isn't it? Let's see them. The recalls for the INI-CET exam, November 2020. So which of the following brace is shown in the given image below? So what was that? This area is the chin rest, right? And this what goes to the pubic area. So what was that? Basically they had given in the exam, the image of Milwaukee brace, right? In the exam they had given the image of Milwaukee brace. And why do we use this Milwaukee brace? Now understand the basic concept. Actually what they were asking you is a question from which topic? The topic was scoliosis. And did you realize that when you have gone through the last few previous years MCQs of the exam, you might have seen that scoliosis is a frequently asked topic. One time it was an angle which was asked. So angle used for scoliosis, it was Cobb's. Second time they asked you, they have given in the last exam, mid-session exam of AIIMS, they had given you one image, X-ray, where there was a probably hemivertebra or a wedge vertebra, and they asked you the cause of scoliosis. So cause of scoliosis in that particular case, it was congenital. So scoliosis can be congenital or idiopathic. So what I want to convey is that topics still remain same, the important points still remain same, but the question is obviously will change, right? So scoliosis, the Cobb's angle, congenital, wedge, hemivertebra and Milwaukee brace. And if you go back to the All India exam, they have already asked about Rizer's cast, right? So Rizer's cast, Milwaukee, these are used for scoliosis. Milwaukee image was given in the exam this time, right? So certain topics which remain important, please go through them thoroughly, properly, and definitely questions you will be easily able to crack, okay? Number 2 was a patient presenting with pain in multiple hand joints with morning stiffness. What all is seen in this patient? What basically, what was a recall from the student is, the question was related to rheumatoid arthritis. And they had a lengthy description of the things, the hints also, they had some lengthy description of the things, and then they asked that what all features are possible except. So based on the recalls we have kept it like elevated CRP, obviously ESR and CRP has raised because it is an inflammatory condition. Symmetrical involvement of the joints, yes, very much true, it is a symmetrical involvement of joint. More common in females, that is also right. And DIP can be spared. Usually DIPs are spared. PIP is involved in rheumatoid arthritis, but deformities are seen in the hands, the bottomia and the swan neck. Okay, so again the rheumatoid topic, and if I recall from the previous years, what question the AIIMS people has asked till now from rheumatoid about the triple deformity of the knee, about the joint which is not involved, the vertebrae and the DIP, about the reasons of deformity, the bottomia and the swan neck. Okay, so topic again remains same, the rheumatoid. Okay, so question number 3, a 10-year male child presenting with a pain around left knee joint, and on X-ray there is a lesion at distal femur extending up to the terminal end, right? So if they would have mentioned in my question that lesion is on mid-thigh area and the age is 10, then I would have preferred Ewing's over anything else. But now the question is, the lesion is at somewhere around the distal end which is extending to the end of the bone. So less than 10 years, the most common malignancy in a kid or in anybody, the most common malignancy that we have in the bones, it is osteosarcoma. So if they have given you the specimen or the X-ray where you have got the Codman's or the Sunray or the sunburst, it is most likely osteosarcoma. If they are mentioning something about the mid-thigh area, it is Ewing sarcoma, right? So do remember the locations, the 3 important things about any of the tumor. If you want to learn the tumors, there are 3 important things to be learned. First thing to be learned and remembered and seen in any MCQ is the location. Find out the nature. If you cannot find out the nature, as simple as that, go for the spatial feature. Go for the spatial feature. These are the 3 things to be learned about any tumor, right? So most likely it was a osteosarcoma, as you can see in the X-ray also. Number 4, which of the following is used for bone formation? Okay, so bone, there are 2 kinds of drugs that we can use for osteoporosis. We all know that, it's very simple. There are 2 kinds of drugs which can be used for osteoporosis. One bone forming and one which inhibit resorption, right? The drugs which inhibit resorption means which block the osteoclastic activity. What is raloxifene? Raloxifene is a SERM. selective estrogen receptor modulator, bisphosphonates, calcitonin. What these all three are, under which categories? These three are the drugs which inhibit the resorption. These are the drugs which inhibit the resorption. Teriparatide is one drug which has got a action of bone formation. This is a synthetic analog of PTH, parathyroid hormone, and what it does, it helps in bone formation. So the only drug which was mentioned over here which help in the formation of the bone, it is teriparatide. Which site is used in vertebra for screw fixation? Okay, this was a kind of topic where I found many students, getting worried, and how to fix the vertebra. Image was given and a screw was given, probably like that, and they asked you from where to fix the screw. Now understand, if you are putting a screw in the body of vertebra, let me show you by showing you certain anatomical pictures. It will be easy for us. So the options given to us, let me use a vertebra. Okay, so options given to us here are, this is a typical vertebra. Now understand by this vertebra. See this. See, when I want to put this is the body of the vertebra. All of you can see the body of the vertebra. So now see where the pointer will be moving. Just have, yeah. So the pedicular area that you see here, this is the pointer. If you can appreciate, if you are able to see the pointer. So this area will be the one. This area will be the one from where the screw will get inside, the pedicular area, right? So if I draw these for you, how will that be? If I draw the image that you have just seen, so body, and then you have got the pedicle, and then attached are all the posterior elements like that. Okay, so what we do is, we transverse process like this. So we pass the screw from this area, the pedicular area, because that is the only area from where I can insert my screws. Otherwise, this is my spinal canal from where the spinal cord is passing. So if I go through spinous process, if I go through transverse process like this, it will breach. But pedicle is the area from where I can put a screw inside the body of the vertebra. So that was pedicle, right? So this was kind of new thing, new concept, or new question, you can say, a high level all the time. Obviously it is AIIMS, it can do anything. Test not commonly used in osteoporosis. See, I could not got the proper recalls. This is what we could recall. So I would not get into such complicated things, but yes, I'll tell you, everybody knows that for osteoporosis, what is used? The only thing we can use, the gold standard, is always a DEXA scan, right? So DEXA scan means the bone scan. Why do we need a bone scan? Bone scan is basically done for a infective pathology. It is not for osteoporosis. It is not going to help you out, right? So gold standard is DEXA. What we do here is, we calculate the bone mineral density, BMD, and how it is that is done, T-score. Okay, so these, obviously the DEXA, infective pathology bone scans, can be done for assessment of tuberculosis, right? CT scans can give you the strength ideas. Chemical analysis, see, X-ray can be done again to see the status of tuberculosis. So if you talk about osteoporosis, DEXA is the gold standard. Bone scans for tuberculosis, X-ray for tuberculosis. CT, it can show you the thickness of the cortices, but not usually done. CTs, nobody is going to get done the bone scans or the CT, but yes, how they can help you out, that is what I'm telling you. Which doesn't help you out at all, the chemical analysis, that is serum calcium, or simply we can say the serum mineral levels, which remains normal in osteoporosis. So gold standard, remember, it is DEXA. Rest all are least helpful. They are not very much helpful in diagnosing. So gold standard always remains DEXA for osteoporosis. 40-year-old patient presents with stiffness of the back with difficulty in bending forward. Looking at the X-ray, what is the most likely diagnosis? The options I could recall from here, they were ankylosing spondylitis, one was fluorosis, and there were two other options as well, which probably we didn't got properly. So fluorosis usually causes stiffness here, the fusion from the back side. Ankylosing usually causes the fusion on the anterior side. So ankylosing spondylitis or fluorosis, these are two options. But when the patient is a young male having back pain, stiffness and all, it goes more in favor of ankylosing spondylitis, because fluorosis is more commonly seen in the pelvic areas first, changes, then in the long bones, then in the spines, whereas the AS is most commonly seen only in the vertebral areas, right? So most likely it was a case of bamboo spine, which again was a repeated topic for your AIIMS point of view, where they had asked for last 2 years about sometimes about the test, the Fletcher's test, the pump handle test, the Ganselin test, or basically the bamboo spine, the image based question. So it is again a repeated topic, I must say, in your AIIMS as well as in JIPMER examination, the ankylosing spondylitis. Okay, so these were all the recalls. So guys, anything if you want for the upcoming NEET examination, that's the WhatsApp number on which you can connect with me anytime you want, right? So any kind of orthopedic query or any kind of academic help I can do from DBMCI point of view, just feel free to connect with me anytime on the given numbers, right? All the best for the upcoming examination. Remain calm, compose, oriented to time, place and person in your exams. Don't get disheartened by the shifting of the dates. They have gone in maybe some 2 to 3 months of delays there, but use this time well, utilize this time well, and keep on completing the subjects if you have left any, and then go for revision, very quick revision. Don't try to let your morale get down that I'm not going to do well, my friend is doing well, I'm not doing well. Everybody is having their own mind capacity. Everybody runs at a different pace. It is all about who remains consistent. So consistency, regularity, discipline, and obviously the revision is the key to success, right? So all the best, guys, and definitely you'll do your best in your exam, right? So thank you so much, and if required, connect with me anytime you want. Thank you.